Welcome to Vitamin B with Mohana. This is where we help you take control of your well-being. My guest today is Dr. Anantharaman, a super specialist endocrinologist who has helped over 25,000 patients. Today we're going to talk about the growing concerns around infertility and how men and women can prepare for healthy pregnancy.
Probability of fertility issues increase as you become older. Fertile period, this is a wide window. So one cannot predict when ovulation would occur.
1 in 15 couples, right, at least on an average, are unable to complete pregnancy.
So obesity can cause a low testosterone. So it's called the male obesity and secondary hypogonadism. Have a lot of green vegetables, green salads, and make it a habit so that your folic acid intake is very good. So I tell them that, the ovulation can be restored through taking oral contraceptives. So I would suggest for men that, stop smoking.
What is the range in a human being for your testosterone level as well as your estrogen level to be healthy?
And when you reduce the insulin level, the androgen level also comes down and the ovulation occurs more frequently. There is a clear benefit for using metformin. So sometimes the pregnancy forms in the fallopian tube as well.
Is your vaginal discharge also get thicker and thinner, etc., right?
As you become older, so you also accumulate some problems related to fertility. There's a vaginal bleeding following conception, then that would indicate a miscarriage. We have something called an ovulation kit that is available. You can actually look at whether there is an ovulation surge that is happening. Addictive substance is a very important part of that, I would say. I mean, now the prevalence among men and women is very high actually. So alcohol consumption. So if you consume alcohol every day, it's very difficult to go off alcohol suddenly when you're pregnant. Actually, same applies to smoking. Miscarriage rates we've not been able to improve miscarriage rates in the last century or more. So there are clear evidence which shows that if you have children, you live longer. So if you have PCOS and if you don't have regular cycles, so you need not be even married actually. So if you have irregular cycles, one can take metformin to make the cycles more regular. You're not met somebody, and that's going to happen sometime 7 years later. So live your life happily. So because whether you conceive or not doesn't depend not only on your PCOS, it depends on your age at the time at which you try. It depends on your partner, whether your partner has sexual dysfunction or not.
So join us to understand more. Sit back, enjoy, and learn. Hi, Vitamin B community. We have always been very bullish about your health and your well-being. And I'm super happy today to be launching the very first merchandise which I know will make a difference to each one of us, which is the Vitamin B Granola. This granola has been in the making for over 2 years now, with our core team having it on a daily basis. So we felt it was important to spread the awareness and ensure each one of you has the opportunity to taste it and improve your health. Get your first pack, order now, and we are available in Namma Bengaluru, where we have a number of customers who have already promised us and validated that this product is truly nutritious. So check out the comments box where you have an opportunity to place your order in the link provided, or reach us on Instagram DM to get your first bag of Vitamin B Granola. I'll see you soon. Stay tuned, be healthy, and be confident.
Welcome to Vitamin B, Dr. Anantharaman. It's a pleasure to have you here.
Thank you for having me.
Great. It's wonderful. I'm so glad that you consult in the area you've been able to join us with studio. Today we are going to be talking about a very important topic, and I think it's a topic that is becoming more important. It's a health issue that is actually surfacing. Unfortunately, what I see around us is so many infertility clinics popping up. In almost every area in Bangalore, let's say in India right now, is really around us. And being an endocrinologist, we felt it was so important to have you here and really learn from you and share a lot of the information as well. Thank you for joining us.
Thank
So let's start the conversation itself with really why are we here, right? Through all the reading that I have been able to do, 1 in 15 couples, right, at least on an average, are unable to conceive today. So it's evidently a growing concern. So why are we talking about it? Why is it important to talk about it?
Um, for the first and foremost reason, it's very common. So very often people think that fertility is something that's given, like So there are many factors in fertility, and fertility refers to it's rather than being a medical problem. I would say fertility is also a medical and a social problem together. So, if and one of the reasons for the increase in subfertility is the older age at which men and women get married and decide to have children. So that's for so many reasons that the day when they try to have conceive and have a baby, it used to be in their early 20s, maybe 30, 40 years ago, and that date has increased as the days go by. And as you become older, so you also accumulate some problems related to fertility. These may be hormone related, this could be related to the anatomy, or it could be related to some infections. So the older you are, the more you'll accumulate the problems. The probability of fertility issues increase as you become older, and also with various diseases. So that's why you are seeing that a number of fertility clinics are rising actually. So that's why mostly the prevalence of fertility problems is increasing. So it's the index of our older age basically. That's number one. That's the primary driver. That's the primary driver. Okay. So fertility issues will be much lesser if couples started having babies in their early 20s, just like before. It'll be much lesser. So that is the number one reason. So number two, number three, number four reasons are otherwise there's no reason why the prevalence of fertility issues will actually increase so much. So there are lifestyle issues as well. We'll cover that I think in the future questions. Yeah.
So that's actually a bit surprising because when a person like me, who's a layman, understands the issue, you always think it's hormone. It's probably a lifetime. But yes, of course, being a person in her early 40s herself, I understand that it could be because I see so many of my friends having children at this age as well right now. So it's interesting, that could be one of the primary reasons as a social change that is around us. So my question would have been that most of your cases are touching 20s, 30s or 40s, but pretty much where are you seeing, infertility the most?
Age group is anyone above the age of 30. Definitely more chances, higher the chances of fertility issues at the time of trying to conceive. So, but it's a very complex topic actually, and the one of the reasons why the fertility clinics are more in Bangalore is that people around Bangalore also come into Bangalore for fertility care. So what happens is there's not much of infrastructure around fertility care. So for a good fertility clinic, you need probably a good embryologist, you need good facilities, you need a lots of healthcare professionals who are also competent, who are also experienced. So the concentration is very high in a place like Bangalore, so which reduces the cost overall. So because of that reason, so you see a lot more fertility clinics in Bangalore than elsewhere. So even smaller tier cities now are seeing a lot of fertility centers. And also, as a society, we place a lot of importance on having children. So once you get married, you must have children. So there's a lot of societal pressure also on having children. So that's why I said fertility care itself is a not only a medical problem; it's a medical and a social this thing. So if having children was not that important for you culturally, then you will not probably, seek out fertility care. That is also.
So that's just a very important differentiator between the West as well as the Eastern countries where we do care about childbearing, we do care about the roles that we actually have. So let's talk a little bit about getting pregnant itself, right? There's so much of misinformation, disinformation. On the other hand, when you look at schooling, college, there's such little or minimal education still on just the overall concept of sex education. But fundamentally, when I was growing up as well, no one told me that there is a body cycle that I have that I should be observed of before preparing to get pregnant, right? So, what kind of technique can people use to know that that's the window that's good? Try to be pregnant there.
So there are the simple answer for women who have regular cycles. I mean, so all women, almost all women will have regular cycles, except for women with PCOS, where the cycle can become irregular, and the gap between, when you say cycle, you need to calculate from the first day of your menstrual period to the first day of the next menstrual period. So on an average it's 25 to 35. Anything less than 25 is abnormal, and anything above 35 is considered abnormal. And this is true for women who beyond 8 years of menarche. Like for example, girls who are in between the age of menarche. See, the age of menarche may be somewhere between 10 and 14 for most girls. So from that time for about 8 years, the cycle length can be little less or more. So we don't consider it abnormal. But beyond 8 years of menarche, so we expect the menstrual cycle to stabilize between 25 and 35 days. So if it is less than 25 days, it's abnormal. It's more than 35 days, it's also considered abnormal. So if you have 35-day cycles, then you'll have 10 cycles a year almost. So 365 days in a year, you'll have 10 cycles. So if you have anything less than 8 or 9 cycles, it's considered irregular cycle. So for those women who are having regular cycle, I'll come to the topic first, which is how to spot the fertile period. So the fertile period is from the 7 days after the start of your cycle till 21 days for 2 weeks duration. Okay. So this is the fertile period. This is a wide window. So one cannot predict when ovulation would occur actually, but the gap between ovulation and the menses is fixed. It's 14 days. Okay. Release of the egg. Okay. So in every month, only one egg will be released. Okay. So, and over a period of reproductive lifespan, a woman's will release one egg every month for these many years. So if it's say 30 years, so 30 into 12, 360 months or about 400 months, there'll be chances of conceiving, 400 chance of conceiving. Yeah.
So, in those 2 week window broadly, right? And to get very technical, which will be very helpful for people as well, is your vaginal discharge also get thicker and thinner, etc. Right? That's another technique to actually understand that you are most ready, right? To get ready.
No, that's one method, but I don't find it very practical. So typically, what we have something called a ovulation kit that is available. So you can actually look at whether there is an ovulation surge that is happening. Okay. So when you actually, because I'm an endocrinologist, so I'm biased towards finding out when the ovulation surge happens. So when the LH surge happens, you can actually detect it by a dipstick, just like how you will detect using a your pregnancy test in a pregnancy test. So you just need to pee into the strip, and if it shows 2 lines, you have had a LH surge. And once you have a LH surge, the subsequent 4 or 5 days are the fertile period. Okay. So so this is more of importance to couples who are actually staying far apart, where the husband or the wife is traveling a lot, etc. But if they are staying together, so the fertile period is just I ask them to have intercourse alternate days starting from the 7th day to 21st day. So you don't really need to time it basically. Okay. So this is one reason where either of the partners is traveling, or there can be a situation where there is sexual dysfunction, there are difficulties around intercourse, and timing it is very important. And if they are not able to, and sometimes the man has to take a Viagra or a PDE5 inhibitor to have intercourse. So these are some of the situations where we need to exactly time the fertility. So and gynecologists also treat fertility issues, and gynecologists do something called a follicular maturation scan. So which is also very accurate. So you do a transvaginal ultrasound to look at whether the egg is about to be released. So the follicle size is more than 18 mm. So it's about to rupture, and they also augment it by giving an injection to make sure that it ruptures immediately. Sometimes the LH surge will happen, but the ovulation will not happen.
LH
Is a luteinizing hormone. Luteinizing hormone. Yeah. For the egg to get released. Yeah.
to understand.
Yeah.
So you touched upon, we'll come back. I have more questions on this. But what is the difference between an endocrinologist and for the public to understand What a gynecologist.
So I'll put it very simply. So an endocrinologist is a physician. So I've not been inside a operating room for last so many decades.
Yeah.
So a gynecologist is a surgeon. The endocrinologist looks mainly at the software. Gynecologist looks at both the software and the hardware part of it. Like for example, if there's any uterine anomaly, if there's a block in the tubes, they look at it, and they look primarily at women's health. Okay, they don't look at men's health actually. So on the men's side, so the software is taken care of by the endocrinologist. So we take care of the hormone signaling between the pituitary and the gonads, both for men and women. Okay, and the urologist takes care of the hardware as far as the men are concerned. Like for example, if there's an obstruction in the path of the sperm release, so then that is taken care of by the urologist. Urologists also deal with fertility issues. So when it comes to fertility, so all these three practitioners are involved. But now gynecologists are specifically trained for fertility treatment. So they undergo, apart from their 3 years of training, another 2 years of training. And the government regulation also says that the fertility treatment or IVF has to be done by a trained fertility specialist. In most of the cases, it's usually a gynecologist, because they need to do surgical intervention also. They need to pick up the egg, they need to, the embryo has to be prepared, and embryo has to be injected back into the uterus, etc. So all these things the gynecologist deals with. So we deal with the hormonal aspects of fertility.
So now that we know what really an endocrinologist ends up doing, right? So much more to learn from you, along with the gynecologist, of course. Is there a right time in the day when actually a couple can get pregnant? Or am I imagining this question altogether?
See, the internet has a lot of urban legends actually. So I don't think there's a perfect timing. I don't know any specific research around it, but definitely these topics of research abound actually. So, but it's not very important clinically. So what time patients try, whether it's morning or evening. So what matters is the whether the ovulation has occurred, and whether they are able to have intercourse, and whether fertility is happening. So I don't think there's any particular time. I mean, I don't, clinically valid answer is not there for that. Yeah.
That really clarifies. And are there some really early signs that I am pregnant?
The earliest sign that you're pregnant is that you'll not get your menstrual cycle. That is the most reliable sign. So other signs are non-specific, like nausea, feeling dizzy. All these things could be a sign of a viral fever or an infection, anything like that. So the best way to know whether you're pregnant is actually to do a urine pregnancy test, which is available everywhere. So, and if you can do the urine pregnancy test and you confirm that you're pregnant, and usually UPT is usually very sensitive, and we don't need to do anything else actually. So, and if you are on fertility treatment, usually the gynecologist gets a beta HCG level done. So, beta HCG is the hormone produced from the it's a human chorionic gonadotropin. It is produced from the chorion basically. So from the implanted fetus basically. So the LH usually stimulates the release. After release of the egg, it luteinizes the ovary and makes the ovary produce progesterone. And progesterone is required for maintaining the pregnancy. Okay, but once the conception occurs, so the conceptus or the fetus itself will produce the same LH as the this thing. So the HCG is the same as LH. It's almost has got a very close sequence homology. It produces the same hormone that the human pituitary produces. So it works on the ovary and keeps the progesterone coming from the ovary. Okay. After about 15 weeks or 16 weeks, so the fetus produces enough of its progesterone. So I think I'm deviating. I'm telling you more. So yeah. So basically, the HCG what the fetus produces is actually the LH that the woman's pituitary will produce. So it takes over and makes the progesterone level high, and the high levels of progesterone and estrogen are both required for maintaining the pregnancy. Yes.
So that's the whole process.
Yeah. It's a very intricate process. That's why it fails so often, actually, and that's why the influence of age is there. So you may think that, okay, 40 years should be okay, but 40 years is not okay. 40 years is 20 years older than 20 years, and the human and the human lifespan is 80 years.
And that's a topic itself that we
Yeah.
get into, because the reality is that
Yeah. It's not that it's nobody's case that we want couples to conceive in 20s, but they should be aware of this risk.
Doctor, since you mentioned, right, that it fails, a pregnancy can fail, what are the signs of a miscarriage, if I may ask?
So bleeding, okay, so that is a sign of miscarriage. So if there's a vaginal bleeding following conception, then that would indicate a miscarriage. So that's the only thing. And very often nowadays, when we do scans in early pregnancy scans, we realize that there's no heartbeat, or this thing or the conceptus is not formed properly. So we don't need to wait until the bleeding occurs. Sometimes the gynecologist will give treatment to end the unwanted pregnancy, or a unviable pregnancy rather.
Okay, so that's mainly the sign. Check out for bleeding, and so
Yeah. You need to get your scan done as soon as you're pregnant. The number one reason for getting the scan done is actually not to confirm the pregnancy, but to confirm that there's no ectopic pregnancy. So sometimes the pregnancy forms in the fallopian tube as well. So fallopian tube, you all know that the uterus is like this, and you have the fallopian tubes on both sides. So the conception actually happens in the fallopian tube, fertilization happens in the fallopian tube, and then the fetus implants in the uterus. But if it implants in the fallopian tube itself, which happens in about 1% of pregnancies, so then that's a problem actually. It can rupture, or there can be a tubal abortion. So that's dangerous. So that's one of the reasons why a early pregnancy scan is very useful. Major reason for miscarriage, reason for miscarriage rates we've not been able to improve miscarriage rates in the last century or more. So people conclude that these are due to genetic problems in the formation of the fetus. So the way embryo while being formed, so there is a genetic, there's a there's a software error or a hardware error, which is fatal actually. And all across the world, irrespective of how old the population is, how young the population is, the miscarriage rates are almost the same across countries, and they don't improve with economic well-being also. It's approximately 15% is the chance of miscarriage actually. Yeah, it's very high. Yeah, 15% of all pregnancies, if you look at it that way. But if you look at the same miscarriage happening twice, that actually drops down to 1%.
the second
Okay.
miscarriage.
Yeah, the chances of having two miscarriages is 1%. Chances of having one miscarriage is approximately 15%. Okay, and the chances of having 3 or 4 miscarriages is even rare. So it does not happen due to chance. If you've had like 2 miscarriages or more, then definitely some issue may be there. You need to get it sorted out. There are conditions which can be treated.
And so, in my understanding, the formation of the zygote, that is essentially the egg and the sperm, creating a zygote, as they call it, which will go into a baby.
Yeah, there can be issues, which is that's largely the reason for the miscarriage.
Wow. And so, let's come a little bit to understanding hormones itself, right? What is the range in a human being for your testosterone level as well as your estrogen level to be healthy? For me to be able to conceive, what's a normal range?
For men, testosterone values have to be above 250 or 300, and for women, they have to have regular cycles. So the estrogen and progesterone levels in women are not a same level. They keep changing with the day of the cycle. So they are very low on the day of the menstrual period. They keep rising through the cycle, and the estrogen level cross about 100 picogram per ml. So around ovulation time. So the high estrogen is what triggers the LH surge. So the high estrogen triggers the LH surge, and then once that happens, so the estrogen level further increases. So there is a second wind as far as the estrogen is concerned, and then the progesterone is again produced. So estrogen and progesterone both are required for conception.
And that helps because the LH surge happens, the egg is released.
Yeah.
And for those who are struggling, and I know that you mentioned that with age it gets harder. However, we just double down on this. is estrogen level, progesterone level, or in testosterone level being lower one of the factors why people are unable to get pregnant?
Yeah, definitely. So let me come to the estrogen or testosterone level being lower is called hypogonadism. So it can be, there are two varieties of hypogonadism. Hypogonadism can be due to a problem in your gonads itself, that is in the testis or the ovary, or it could be because of an abnormality in the pituitary gland. So typically, if the abnormality is in the pituitary gland, it can be treated easily. So we can then LH, FSH both are less, and therefore the estrogen and progesterone are not produced. And we provide the LH and FSH in a particular fashion, then the growth of the gonad and the production of gametes, everything will be normal. Okay, we can more or less normalize. But if there's a problem with the testis or the ovary per se, then conception becomes more difficult actually. So that becomes more difficult. So so typically we don't identify these conditions when there is a difficulty in conceiving. So if the testosterone is low, so we get indication from before puberty or around the puberty time itself. For example, boys will not develop a beard or will not get secondary sexual characteristics. The same applies to girls as well. So they do not develop a breast, they do not develop, they do not get a cycle. So we are aware of these issues from before. So these patients are treated by the endocrinologist from well before their fertility time. So their fertility time is actually when they are in their late 20s and early 30s. So, but we refer those patients to the gynecologist when the this thing. So this is again answer to your question: what does the gynecologist do?
So just coming back to the whole aspect of what's going on today, right? People are seeking a lot of help to get pregnant. I want to touch upon drugs for a little bit, right? The administration of drugs is actually helping people get pregnant. But there seems to also be a lot of sort of skepticism around it, the right information. There's also, very honestly, there's a lot of talk that doctors are just giving medicine for the sake of it, or they're recommending a lot of IVF, IUI, and a whole new technology that's meant to do good. But let's clarify something, right? Let's take, for example, metformin. It's a drug that is typically used to help you get pregnant. It's given to women, if I'm correct. And it's given before pregnancy, but it continues to be given a little bit afterwards also. So, doctor, can you help us understand, the whole space of drug usage, how helpful it is, and what are the long-term effects if I take it actually?
Um, it's a very complex this thing. So first, let me address your specific question, which is metformin. So when you look at metformin, can be taken for so many reasons. So if you have PCOS and if you don't have regular cycles, so you need not be even married actually. So if you have irregular cycles, one can take metformin to make the cycles more regular, because it brings down the insulin resistance, and the insulin resistance is the fundamental cause for the high androgen which is present, high amount of testosterone that's present in women with PCOS. And when you reduce the insulin level, the androgen level also comes down and the ovulation occurs more frequently. There's a clear benefit for using metformin in order to restore the cycles. Okay. As regards, fertility treatment, so we have better things to give for fertility treatment. And fertility treatment, no, so usually the patient wants a result in a time-bound fashion. Okay. So, or they may say that, oh, okay, it's okay if I conceive, you just give me a mild treatment. I don't want to this thing. So, it's the choice of the patient. So the choice of the patient, the context determines what we give usually. So if a couple have been married for like 2-3 years and they are looking to conceive now, then metformin would not be a good choice for the patient. So then we'll go for a, if the woman is having PCOS, then we'll give a letrozole or a clomiphene as a treatment to induce ovulation. So this is a basic treatment which can be done on an outpatient basis. You don't really need a fertility treatment. And this works for a good number of women with PCOS. So they don't really need a IVF or a IUI actually. And IVF will be required after multiple such attempts have actually failed. So and even this is actually done by the gynecologist only. So gynecologist does because they'll do a follicular maturation scan. With the coming to the same point, so we cannot be stimulating the ovary every month on month for 10 months, 15 months. So in order to get a better outcome, so if we do the letrozole and also monitor the ovulation very carefully, then the outcome improves and the conception occurs. See, once the conception occurs, we are not worried about that anymore. So the patient's symptom has been extinguished.
But are there long-term issues with regards to using medicine?
No, this has been studied quite a bit. So, in fact, most of these drugs do enter the market after a great deal of versus placebo testing, and there are some issues around using letrozole or clomiphene. So, you can get multiple cysts in the ovary. It's more with clomiphene and less with letrozole, and more common, like I said, it's more common with clomiphene. Sometimes, very rarely, you can get something called ovarian hyperstimulation, but this affects less than 1% of women who are taking the medication. So per cycle, like if 100 women take a fertility stimulating therapy, less than one will have a potential problem. But the vast majority do very well with it, and the success rate is very high, so 80-90%. So the success rate for inducing ovulation is very high. Conception rate is slightly lesser. So this is how we study things. Actually, there may be potential side effects to every intervention. So what I tell patients is that even crossing the road is risky. So, but if you've been trying naturally for about a year and you've been taking, you've been doing diet, you've been doing exercise, you've been trying everything, but still not conceiving, then it also causes a lot of distress, isn't it? So, and you really want to conceive, so it causes a lot of social problems. These are also issues which need to be sorted out. So,
I think that is now, real statement, I would say, because a number of people that I know, doctor, when they have actually approached a clinic, etc., for infertility, the first thing is not to check the background. I don't know why this is happening a lot. It's a trend that's going, and one needs to be a little bit. That's why I'm asking this question, right? Where before you understand the duration of wait, the first recommendation is go to an IVF. It's become so common now, which has then impacted women in the pelvic. So, women end up peeing when they come. Lot of other problems there. So it's really great that you mentioned that wait it out, try everything, and this could come later at a stage where you don't have an option in a natural manner.
so it depends. See, when you say fertility center, no. See, when you say doctor, you say healthcare center. So you need to choose the person wisely, or you can ask if you have a family doctor, you can ask them for recommendation rather than choose on your own. So how to choose a doctor is a separate topic in itself, actually. So the thing is, you cannot. So I'm talking about the interventions themselves rather than about the quality of the healthcare. So that's a separate topic altogether. So if things are done the proper way, so then the outcome is only going to be better. So the outcomes can be improved for every patient who comes to your clinic. So that's my endeavor. So whenever a patient comes into my clinic, we give the right information so that the outcome is better for that patient at that time. So that's the whole purpose of medicine. So very often there may be honest mistakes and also deliberate mistakes. So what you have mentioned, so there can be like a little bit of this thing, but honest mistakes are more common. So it's not that, it's just that maybe your doctor is not that experienced. Okay, so experience no, of course, takes time, right? So and obviously all doctors cannot be equally experienced, and all patients cannot go to all doctors who are experienced, right? So it's not possible. So it's just a question of time. So there's only on Saturdays I get a huge number of requests for appointment. Even if I want to, I can't see 200 patients, no, on a Saturday, just because I'm an experienced doctor. So it doesn't mean that every patient I can see. And of course, I'm a human being and my output goes down, as this thing. So that is by nature of the dealing itself. No, it is a issue. So the idea should be that every doctor is equally trained and the mistakes are less. So, but the mistakes will become lesser and lesser as the doctor's experience improves.
So the choice of the doctor.
Yeah, yeah. It plays a not a key role. It is the it's a main role.
Um, let's talk a little bit about hormone health. Almost every other video on the internet is talking about so many dysfunctions. Everything is impacting, the ability to conceive itself. What should we know about the issues around hormonal health that's contributing to whether it's getting pregnant or having trouble conceiving?
Yeah. So let me start with the reassurance. So I think when you're in your 20s or in your early or even less than 20 years, so the society may have an anxiety around whether you will conceive or not. It's not good to have that anxiety. Okay, you should not think about whether you will have a baby or not. I mean, I have men who are in their early 20s or 23, 24 years of age, who are not going to get married in the next 7 years, who want to get a semen analysis done to check whether they are going to have a baby or not. So I ask them, don't do it, because you don't know whether whom you're going to get married to is going to have a normal fertility. See, fertility takes both a man and a woman. Okay, you're not met somebody, and that's going to happen sometime 7 years later. So live your life happily. Okay. So I mean, you don't need to get a fertility test done unless this thing. So you cross the bridge when it comes. Actually, this also leads to a lot of anxiety. In fact, majority of people who are looking at this podcast will be people who are anxious about their fertility. You may have PCOS and your cycles are irregular when you are in your early 20s, but that's not going to answer the question whether you're going to conceive or not when you're 30, actually. So, because whether you conceive or not doesn't depend not only on your PCOS, it depends on your age at the time at which you try. It depends on your partner, whether your partner has sexual dysfunction or not, or whether partner is fertile or not. All these things. So, your fertility accounts for only 50% of the couple's fertility. Okay, so it doesn't make any sense to think about fertility before you have a partner. So please find a partner if you then you look at the fertility. So that's the number one advice I'll give to young people. Okay, so for people who are married or who are planning to get married soon and who are concerned about their reproductive outcome, so I would suggest for men that stop smoking. Okay, because that doesn't help at all. Okay, because you may get a heart attack or a stroke, or you may become incapable of this thing. So it causes also erectile dysfunction even in very healthy men, who are lifting weights, who are looking very ripped. Also, smoking causes erectile dysfunction. Okay, so stop smoking, number one. Number two is lose weight. If you're overweight, be physically active. So this is the advice I'll give to men. And also screen yourself for the presence of diabetes starting from the age of 20, 22. So these are the basic three things as far as the reproductive health is concerned. And when it comes to women, it's very similar. So if a woman has PCOS, losing weight, doing regular exercise, these two things will really help actually. For those women who are not overweight or obese and who are lean, then working out, exercising, changing your body composition, that helps actually. Putting on, gaining muscle mass and reducing the body fat percentage really helps in regularizing the cycle.
Most of the concerns that we see and people as well as what you read is around thyroid, is around PCOS for women, if I'm correct. And for men, is there something similar around hormone itself? Like, is there a testosterone issue? And of course, what you mentioned is all the things that contribute to disbalancing and creating an issue with these hormones. But is there something that we should know about really thyroid, PCOS? Why does it happen? What again? It's a range of things that come to my mind. But what are the problems that people should be aware of that they should?
So PCOS is something about which all women should be aware of. Okay, so PCOS is a very common condition. So PCOS is a clinical diagnosis. You don't need to go to the doctor need to ask you a few questions and make the diagnosis. That's how it is. So PCOS, the full form of PCOS, polycystic ovary syndrome. It affects about 10% of all women. Okay, so basically in this condition, what happens is there is a combination of three things that happens actually. One is your testosterone or the male hormone increases more than what it usually should be for your age and things like that. That's one thing. And due to that, you can have excess hair growth or acne or hair thinning. So these are some of the symptoms related to the high androgen level. Second is your ovary becomes little enlarged and there are multiple small follicles. Small follicles are usually, it's not large follicles. So large follicle is a cyst. It's not a PCOS. So PCOS follicles are actually less than 10 mm. Okay, but there are many. They stud the ovary and the ovary becomes a little thicker. And this is also associated very commonly with weight gain and if not with weight gain, with insulin resistance. But there are a small minority of women with PCOS who don't have insulin resistance also. So these are some genetic abnormalities in the ovary itself, which causes irregular ovulation. Okay, so in this condition, what happens is that every month you don't ovulate. Okay, so instead of ovulating every month, you ovulate every 2 months or 3 months. But more or less, ovulation is really more of a scare for the parents. So usually the parents bring the girl when she's like 17 or 18 and saying the cycles are irregular, what will happen to her future and all. So I tell them that the ovulation can be restored through taking oral contraceptives, and regular exercise and weight training, etc., will restore cycles in a large majority of women with PCOS. So that symptom gets better. But fertility itself requires ovulation induction. So when we have a easy solution for it, then we should use it.
Understood. And what's the role of thyroid? And in terms of the issues that
Yeah, thyroid dysfunction is again very common. Okay, but clinically it's not, I would not say it's a major problem like a PCOS. So PCOS can cause significant fertility issues, like so because the cycles themselves are not regular, there's a significant problem with ovulation. So thyroid dysfunction is again very common. Almost 10% of women have it. Almost 2 to 3% of men have thyroid dysfunction. Is easily diagnosed by a blood test. If you have a thyroid dysfunction, you just need to take a tablet. That's it. So you just take the levothyroxine supplement. In 2-3 months time, your TSH is normal, and if your TSH is normal, your fertility also should be normal. If a couple comes in with a difficulty conceiving, the first thing we check is the thyroid dysfunction. So if it is there, we give the treatment. It's all right in a month's time. So it's not really a major issue for the doctor.
so that's for women. For men, you mentioned that is there a it's a testosterone fluctuation that happens because of lifestyle.
Yeah. Sometimes obesity can cause a low testosterone, lifestyle related issue. So obesity can cause a low testosterone. So it's called the male obesity and secondary hypogonadism. Okay. So it's a new term which has been coined actually for men who become very obese, rather very obese, and that causes, the obesity itself causes a reduction in LH and FSH, and that causes difficulty in conceiving, etc. But it's being recognized only over the last 10 years. So, and very often weight loss improves the hypogonadism, just like what in PCOS, women get, but that's much lesser percentage when compared to PCOS. PCOS is extremely common.
Wow. And what's the like one? You can say one in three.
1 in 10 women have PCOS.
And has it got worse with the rates?
Because of the obesity epidemic. So if you have a mild tendency to PCOS, and PCOS is a polygenetic condition, so it's in your genes. Okay, so when you put on weight, and if you're completely sedentary for months together, the cycles will start skipping. So, and when you actually get to the gym, do workout and eat healthy, watch your weight, etc., and you need to do it day after day. So, and if you do it consistently, the cycles start coming once again. So patients will tell you this actually. But if you add very bad lifestyle to this, then it becomes a huge problem.
And doctor, you just mentioned that there's LH and FSH in men.
Yes, it's both. It's the same in both. FSH is responsible for sperm development. LH is responsible for testosterone production within the testis, and the testosterone which is produced within the testis is again very important for the sperm production. So FSH and LH both are required. They're very pivotal as far as spermatogenesis and testosterone production both are concerned.
Great. And the last thing I have on hormone is what is an androgen, the role that androgen plays? Because sex hormone.
So androgen is basically a sex hormone which is responsible for all masculine features. That is basically growth of hair in the upper lip and chin, development of musculature. So men and women have a different set of musculature, no? So development of deltoid, pectoralis, the breaking of the voice, the growth of the larynx again is due to the deepening of voice is due to androgen. So the androgen is responsible for all secondary sexual characteristics. Androgen is also responsible for penile growth and growth of the hair in the pubic area. So women also have androgen because if you look at the biochemistry behind estrogen production, you cannot have estrogen without androgen. So small amount of androgen is produced in the ovary that gets converted into estrogen, and the estrogen is more in women actually. So women have very less androgen level. They have androgen levels, say 30 nanogram per deciliter. Men have 10 times that, 300 nanogram per deciliter. Okay, so if we give large amount of androgen to women, they will also look uh, male-like actually.
Something that is happening by any chance that is also contributing to disability to conceive?
No, no, not. It's not really. There are no androgens in the environment. In fact, there is actually more estrogens in the environment. Actually, so estrogens in the yeah.
Completely different 1 hour we need to spend. I think. So let's move to something that's also quite personal to me. A few years back, and I'm in my early 40s, like I mentioned, right? A few years back, I took a decision that I would treat my eggs, right? And I said I will keep myself healthy, and I'd love to have the choice to be empowered. I have not had the opportunity to have a child. It's a personal decision. There are so many couples like me today. And when you started the show, it was quite, I was actually quite surprised that the pivotal reason for most of the causes of lack of conception, ability to conceive, due to the age factor,
Yeah.
in modernizing India, right? So these are the side effects. So, what can people like me, a man, a woman, do to ensure that we have safe pregnancy? How do we keep ourselves healthy? What are the steps should we be taking?
So that's the entire, it's that's vitamin B will tell you more about it than me. I think, I think you need to watch all the vlogs in this series, and then you'll know how to get healthy. So it's not an easy answer. So you need to stay consistent. I would say only one word as far as staying healthy is concerned is consistency. Okay, and also seek medical help. Okay, so despite all our effort at wellness, okay, so the human being comes with manufacturing defects, right? So whenever I talk to patients, they ask me, why did I get this problem? This is a very philosophical question. So the doctor cannot tell you why you got the problem. The doctor can only solve your problem now that you have it actually. So there's a lot of genetic variation in illnesses, we mentioned PCOS affects 10%, but the other 9% don't have any problem. Other 9 out of 10 women have absolutely no problem. Okay, so ovulatory dysfunction. So ovulatory infection, though it's very common, it's not you know it's not like 50% of women have. So you don't need to be worried about everything. So that's one thing. And another thing is, uh, once you have the disease, you need to deal with it actually. So sometimes it may be that you're doing everything in your power to stay healthy, but still the health is not improving. Then you need to seek medical help actually. So we cannot say that no, not older, even younger also. Even you may be in your 20s and may still have difficulty conceiving. Okay, so the level of difficulty varies from person to person. So it's not that if you do only diet and exercise and do only wellness, you can solve all your problems. It will solve most of your problems, and it's very important to do that, because that's the only thing you have agency over. Okay, as an individual, we don't have agency over how our genetics are. See, for example, even if I work out a lot, I mean, if I'm not able to put on the muscle mass like someone who does half my effort, so I have no agency over it. No, so only thing I can do is I can try harder.
So,
So
Gaurav, what are the risks of having babies? Let's say 30, 35, 40. So many women are having that. For men and women, what are the risks?
uh, you mean to say risks to their health or risks to the offspring? Risk to the own health, I would not say it's very large up to the age of 45. Okay, if women are healthy, so if they do not have diabetes or hypertension, so I do deal with only patients with diabetes, hypertension, help them conceive, manage them throughout the pregnancy, etc. So cardiovascular disease, fortunately for us, is very less common in women. Okay, I have not seen women get a heart attack during pregnancy, etc. So those all can happen above the age of 50. So, but men are really unhealthy in their 40s actually. Men can get heart attacks in their 40s, okay, very commonly. But fortunately for us, it's mainly revolving around women's health. So, between 40 to 50, as long as you don't have any major condition like a diabetes or hypertension, it should be okay. I mean, you just need regular contact with your physician in addition to your gynecologist, who takes care of most of the things. and it should be all right. So obstetric complications are more common above the age of 40, preterm delivery, okay, so requiring premature delivery, then requiring a cesarean section, okay. So around the time of delivery, some complication occurring could be a little more common as you're older, but more or less you should sail through pregnancy even in your 40s, without any trouble, if you are fit and you're healthy and you don't have any other conditions. Yeah.
Valuable. And is there any, of course, like we always talk about, it's just what's in your control. I love what you said, right? Go to the gym or do some sort of, have a rhythm to your well being, eat the right food. But anything else that one should do to take better care of themselves in order to get pregnant as we get older?
Anything, there's nothing specific as such. I mean, I would say it's general. I mean, it's more of everything. Okay. And avoiding smoking, avoiding alcohol or addictive substances is a very important part of that, I would say. I mean, now the prevalence among men and women is very high actually. So, alcohol consumption. So, if you consume alcohol every day, it's very difficult to go off alcohol suddenly when you're pregnant, actually. Same applies to smoking.
Okay.
Yeah, yeah, yeah.
So, doctor, something else that comes to my mind is just before you're trying to conceive, this 2 week window that you talked about, the precious 2 weeks, right? Is there any preparation work that men and women should do?
There's nothing like that. There's nothing like that. So they just need to be very healthy in general. I mean, as healthy as possible, because the 2 weeks is too late, too less of a time to improve your health. So,
Really
mm,
talking about is this is a question that when I talk to a few people
mm,
that you will be coming on the show, they asked me to ask you that is there anything? For example, one of the things that a female friend of mine mentioned was, can the guy just stop smoking for that 1 month before? Does it even impact? Sounds very small, but
no, I would want no, the guy should stop smoking permanently, not for 15 days. Okay. So the bigger problem is that he'll die after the child is born. Okay, so he'll get an MI after a few years or get a cancer, then that's an even bigger problem. Actually, there's a real risk of that happening. Actually, so I think there's no quick fix answer to fertility, or because fertility is like a I would say that if you want your fertility to go off well, I mean you need to work on it every day. So, but don't think about fertility all the time. So it doesn't help to think about fertility all the time. So like you cannot wake up when you're 18 and say that, oh, I'll have a problem when I'm 30 and then I'm going to do something about it today. So life doesn't work like that, unfortunately.
up to a point of stress, right? So if I just link the previous question, what the lady friend of mine mentioned, uh, does being stressful impact, your ability to conceive as well, right? And that influences the closer you are to trying to get pregnant and you're really stressed with work, with social pressure, with family. How does that really influence? Have you noticed cases like?
Yes, ma'am. So stress does play a huge role in fertility, and unfortunately, fertility itself is socially stressful. Okay, so we cannot see when you are busy working, so and your things in your life are not settled, so you have a lot of financial pressure also. So how will I take care of the baby? So you need to work also. You need to earn money to support the baby. So these are practical problems which arises for everyone. So, and if you are the kind of person who gets stressed out very easily, I would not, again I will not place the focus on the stress itself. I would place the focus on your resilience, basically. So if you must identify whether you are more likely to be stressed out by various situations. So if you are likely to be stressed out by various situations, then seek help, talk to a counselor. Okay, doing regular exercise does reduce anxiety. Okay, so doing regular exercise does reduce anxiety, doing meditation reduces anxiety. All this will really help in you weathering the stress, actually. But the stress cannot be taken out. I mean, stress is there. I mean, you'll have to deal with it. Yeah, we can only become stronger, that's all.
And as we sort of inch closer to the last part of our conversation, which has been super enriching to me personally, right? I also want to explore the dimension of food. Are there specific foods? Everybody knows pretty much everywhere on the internet, you know what the good foods are. You know that you need to eat greens, you need to eat colorful foods, keep it rainbow, blue sugar, all of that is great. But is there something essential that actually facilitates fertility itself for both men and women? Should we be eating something?
So, as far as women are concerned, folate intake is very good. Okay, have a lot of green vegetables, green salads. Okay, so have that for about a few months before you conceive, and continue having that. Make it a habit so that your folic acid intake is very good. And again, the quality of the vegetables, all that matters actually. So have a lot of spinach, green veggies. That's really good for the folate level. So in fact, your gynecologist may put you on a folate supplement, and even I put women on folic acid supplement just to make sure that we don't miss out despite doing that, because folic acid, low folate levels are associated with neural tube defects actually, so malformation in the baby. So we want all women to take adequate folate, and of course make sure you don't have an anemia, or make sure that your nutrition is okay before you conceive. And one thing I would recommend all women who are planning pregnancy is to do a health check. We do it at random times, but the ideal time to do it will be like 15 days before or a month before pregnancy. All women should have it to make sure that they are not anemic. So if you do it well before, like 3 months before, so it gives you time to correct the anemia.
And what about men? Is there anything that they should eat specifically, any sort of nutrients that can help?
There's nothing like that. I mean, they should eat a healthy diet, like what you mentioned, and avoid junk and avoid alcohol and smoking. Alcohol, excessive amount of alcohol, it again causes sexual dysfunction.
It
Okay.
seems like you mentioned it so many times, it looks like it's very common. Right?
Yeah, yeah, yeah.
And what about the whole occurrence of male breath? It's linked so much to estrogen level increasing in men. How, first of all, that phenomena is that really a growing trend? Number one. Second is what's that impact of the increase of estrogen, male breast syndrome to actually.
Fertility issues. See, male breast is very common. Okay. If you take boys who are adolescent, almost 10% of boys will have gynecomastia. Okay. So gynecomastia is breast enlargement in a male. So it boils down to the same thing. Like, for example, if too much of testosterone is produced, some of it will get converted to estrogen, and that causes breast enlargement. But usually what happens is, in boys, as the days progress, so the testosterone level which started at say 30 or 40 will become 300. When it goes to 300, then the estrogen gets suppressed and the breast shrinks back again. So by the age of 20, almost 1% of men only will have gynecomastia. And if you take men who are obese, or consuming alcohol, or having a liver disease or a fatty liver, so these all conditions are associated with more gynecomastia. But really, that does not translate into a fertility issue. So really, it does not translate to a fertility issue. It's more correlated with sexual dysfunction. So this thing.
But the fact that you have a male breast syndrome is basically because of your food and obesity.
Yeah, yeah, yeah. Testosterone level, more than testosterone level down, it increases the estrogen, endogenous estrogen, and relatively the testosterone level is not as high. I mean, the testosterone level, which could have been 600, is probably 300. Problem with the evidence is, it's even though, if you do a descriptive study, look at the what has happened, it is associated with a lot of biases actually. One cannot conclude that the dairy usage is going to cause a problem. Okay, very, very difficult to conclude in the real life situation, unless you give dairy to one set of people and no dairy to another set of people. Do a randomized control trial. That's the only way you will know whether there is an effect actually, or the effect is very large. It's like day and night actually, so that we don't see. So because what happens is, when you say you do this, you do this, you do this, you add all that adds cost to the patient. No? So you don't drink what is that Nandini milk. You have only this A1 heritage milk, which is from a cow and all that. A2 cow or whatever. I mean, I don't know anything about it actually. So, but probably there's no medical indication. As a medical professional, we cannot recommend one or the other, because we really don't know what is the benefit actually. So there are claims that are made. No, so the Colgate toothpaste is always new and improved.
Doctor, just taking a step back, and I think we should have discussed, and I'd love to include it in the podcast, for those who are aging parents or older parents, or etc., who are making a choice to have a child. We understood what are their own risks, right? What we should be taking care in order to have a healthy pregnancy. What are the things that we should be caring about or thoughtful about for the offspring health as well? So, for example, chromosomal abnormalities, right? As you get
Yeah.
what things like that? What are some of the things that we can do?
Chromosomal abnormalities are screened for routinely in any pregnancy. So, and in a IVF pregnancy, we can always do the karyotype of the embryo also. So, we can do something called a pre-implantation genetic testing. So, you don't need to go through the conception itself for you to find out whether there is a problem. So, in an IVF setting, okay. So, that can be avoided. There's something called a PGD, which you can do when you're going to do an IVF in your frozen egg and thing. So, so the embryos are fertilized, and then you can do a pre-implantation genetic testing even before the conception. Yes, the embryo. Yeah, you can check the karyotype. Okay. They are not supposed to do sex determination. That's against the law. But then the karyotype can be checked for other chromosomes.
So even before you implant it with a new, they will check the health of the egg.
Embryo. Yeah. So that way IVF is safer with PGD. It's safer because even though you do all the tests, there can be mishaps. There are documented. The sensitivity is almost 99%. It doesn't pick up 100% of all the chromosomal abnormalities. Though the chromosomal abnormalities are not that common. It's like at the age of 45, the risk of Downs is 1 in 45 women actually. So it's still 44 out of 45, you're all right actually. It's like 5. It's 2%. That's quite high, no?
And that's still with aging.
Now that's at the age of 40, 45.
Great. I think that's very important for us. So, doctor, my final question is, when we were actually sort of preparing for this podcast, you mentioned the elephant in the room, right? When you look back, our parents, our grandparents, they got married. They had a social framework where you had to have children. Like it was a natural thing also that your family had children, right? But it also comes. I remember growing up, and parts of that, that experience was I asked for something, and my parents couldn't afford it, right? So it made me think that hey, you have 2 children, 3 children, but they cannot afford so many. And today things are so expensive, and it is going to get even more expensive, right? And it's stressful having a job. What is the role of financial management in taking what's going on?
So I think you should be self-contented. So one thing I'll tell you. So I'll quote some research from even Scandinavian countries which have got a welfare state. They are supposed to take care of you till you are dead. The state takes care of you till you're dead. So there are clear evidence which shows that if you have children, you live longer. Okay, so that is simple as that. Okay, so so you may say that when you are young, when you are in your 40s, you may feel that children are not required and you can manage on your own. But when you cross 60, 65, then that's when you really need the children. So you being not dependent on them financially is different, but physically you will require people around you. So the family is the unit of success of the human race actually. Okay, so so how to yeah, so that's a choice, and this thing you make actually. So you decide not to have children, you prioritize financial well-being, or you may do like trips to Europe every year actually, but no one will be there to take care of you when you're 70.
But you would advise to your patients to actually plan financially in order to conceive, right? Given that
Yeah, they should do that. I mean, there are experts in the field actually. So that's the trade-off you make actually. When you decide not to have children, you make the trade-off, saying that I'm happy with my lifestyle now, and I don't want to have children, and but I'll take care of it when I'm 60 or 70. But more often than not, it's very tough to do that when you're older. So this is a trade-off that people in the West have already made. Okay, there are a lot of elderly old men and women who are living by themselves actually.
so, doctor, I also want to understand your observation of the trend when patients come to you and younger patients, right? Are they making good financial? Like,
No, I don't discuss that with them actually, but that's very much crucial to this thing. Don't spend the money you don't have. Don't borrow money. Okay, so and having children is expensive, but not having children is also equally expensive. So it's not going to. It's a trade off basically. So yeah, it's just a question of when you're going to pay for it.
Great. So, have I
Yeah.
not asked you something that I should have asked, doctor, that would be valuable for our audience to know?
Oh, it's okay. It was a free flowing conversation. It's okay. I mean, thanks for putting me at ease and asking all the relevant questions. I mean, I kept it very general, I suppose. I think if you want a more technical take, I can do it later.
We can call you back, right? Because there is
Yeah, because we want, yeah, because it's not a medical this thing. So it's how you should deal with your health rather than it's not here to explain any disease. I mean, there are plenty of videos out there which will show you what the disease is all about.
absolutely. So, on that note, thank you for such an enlightening, rich, and amazing conversation. I truly, find that even at this stage in my life, it's very, very useful. And sometimes you have to revisit the basics, what they taught me in school.
Yeah.
That's been really, really good. Thank you, and I'm sure our listeners have